I was a professor of surgery at Sydney University and worked at Concord Hospital. I've been in the Army Reserve for maybe about 10 years. In fact, a colleague of mine invited me to join the reserve. They were short of surgeons, and they had an exercise K, I think it was K89. And he said, would you mind? And I thought, well, I'm pretty well established and I can probably get the time off. Why not? It forced me to take my first holiday from work, because I'm a bit of a workaholic, as many people in my field are, and I enjoyed it. I grew up in that post-war period. I was in the cadets at school. It was a time when we could get on the train and go home with our 303 over our shoulder. You can't imagine that today. But I think I grew up with that idea that we should be doing something along those lines. I think it was inbred in our education, and it was a natural thing. It wasn't a difficult decision. Well, the process started with a very nice girl ringing me and asking me if I'd do it. And I thought, well, that's interesting that they would choose someone with a very nice voice to... And I was in my office at the time, and I thought, well, I've been in the reserve. It's pointless just being in the reserve if you're not going to do anything. And here's an opportunity to do something. So I said yes, and then I told my wife and kids, and they accepted it. Dash of danger, as my wife said, but so that was, getting the family on side was okay. We did do some interesting exercises out at Liverpool, where we would have sort of pretend casualties come in and clearing stations, and it was interesting really, because you'd have a case station and someone would bring in something, and we'd go through all the aspects of what you do to revive them and prepare them for theatre, and maybe even take them to theatre. And it would be all over in 10, 20 minutes, whereas in reality, it's hours, which we learnt. If you made your calculations based on our prep, we would wow. And we hadn't, the Australian military hadn't been engaged really since Vietnam, so there's a big gap between experience and what we were then. So we did do, we developed an operating theatre that was in a container. The concept being you could put it on a Herc and fly it anywhere, and it would open up and it could be used within 24 hours or so as an operating theatre. So I was involved in that to some extent, and it had an anaesthetic theatre, or preparation bay, and a recovery bay. So three containers, and you sort of had a little mini operating suite. To try it out, they wanted to have some genuine patients. So they took us down to Shepparton, and there's a paddock there somewhere, and set it up. And then they needed real patients. Now, where do you get real patients to come into a paddock? I think it was Dookie Agricultural College. Well, there were a lot of people in the army in Melbourne waiting for vasectomies. So we did a week of vasectomies to put it through all its paces. And so it wasn't quite preparation for military wounds, but it was getting a feel for working with all these people, who, many of whom actually turned up in Rwanda, because we came from all sorts of backgrounds to Rwanda. It wasn't a unit per se, or the medical side of it wasn't. It was put together by people with expertise from various states and various backgrounds, Air Force, Navy and Army, really. We had briefings, and we had the legal aspects of what we were doing, and what we could and couldn't do, which I think was very important. And it played out certainly while we were there, when we were stopped in transit at one stage, and it could have been a very threatening situation, but our protectors were very disciplined and didn't do anything silly, and we got through it all. But the legal aspect was important. The medical side, essentially they saw us as going to look after the UN troops, but in fact we looked after the locals who were horribly injured by mines and other things. So the preparation for what we really needed, for instance, paediatric equipment and that, it wasn't there. But Peter Trelagan, who was my anaesthetist, he's a cardiac anaesthetist at Prince Alfred, had the foresight to think about what we might need, and he brought a lot of paediatric stuff as well. So, and a lot of the operations we did were on children. Yeah. So the preparation, it was a very, I think if you read the history, it was a very rushed preparation for everyone. But what they were relying on the specialists, and there was myself as a surgeon, there was an orthopaedic surgeon, there was an intensivist and an anaesthetist. So they really wanted our expertise in the field that we practiced. And because the Australian military isn't big enough to have full-time surgeons, etc., anaesthetists, they always had to rely on the reserve. And it was a good thing because we're people who were operating in the belly and the chest and the legs every day of the week, whereas if you're a surgeon in the army, you're doing ankle injuries and knee injuries, and not to detract from them, but it's much lighter surgery. And they're not so familiar with the belly, as they found out actually in the first wave. They sent a lovely fellow who was a full-time army surgeon, and he was clearly out of his depth. We went up to Darwin, and then I think from Darwin we went to South Africa, to Johannesburg, I think, and then we flew in a Spanish Air Force flight to Rwanda, to Kigali. It was, to our amazement, that the Spanish Air Force was so big, and it was big because it was engaged in UN work, where it was much bigger than the Australian Air Force. And it was just a Herc that they flew us up in. But yeah, so that's how we got there, and we were greeted by Wayne Ramsey, who was the commander of the first round, who we knew because he had been the commander of the field hospital out at Ingleburn, and he turned up with a couple of jeeps and an armed protection unit, and that was the first time we realised we needed to be protected all the way, and it was very nice to see him. We were put into the Kigali General Hospital, and we were billeted, if you could say that, in the bombed-out maternity wing, and the whole place was shot up. The bullet wounds all over the building walls and all that sort of thing. All the glass had been blown out. I think the first night we slept in the boiler room, not that it was working. The place was a mess, but the engineers had been in there a few weeks, or maybe 6 or 8 weeks before, and they'd cleaned out all the bodies and removed all the blood stains from the operating theatre. There were big mass graves along the side. It was makeshift, but it was actually functional. They'd actually, in a very short time, made it a functional area to work. And there were some wards with patients already, because I was in, I think, the third lot of specialists who went over. So that was about after the second month, maybe into the third month of our experience there. And we had a handover, took into account what was there, and they introduced me to a young boy of about 12 who was going to be on the operating list the next morning. And they said, "We've kept him for you." I said, "Oh, that's very nice." But the thing was that he had a shrapnel wound to his neck with a false aneurysm, a blowout of his carotid artery. And in the real world, I was an international expert on carotid artery disease. But we didn't have x-rays or appropriate x-rays or anything else. He just went by clinical signs. But I was very pleased that the first case I did with theatre staff that I wasn't all that familiar with, an environment I wasn't familiar with, but in an anatomical area that I was very familiar with. And it all went fairly smoothly, and I think I relaxed after that, I could work with these people, they could work with me, and of course that was easy peasy compared to what we had to deal with subsequently with all the mine wounds. But it was, and there's always anxiety, I think, when you're doing something for the first time, and that was very good that it worked well. So I think I slept in what was the office. It was the director of obstetrics office. There was a bed there, but we did sleep with our rifle under the pillow, and we had an escape route planned through the roof and down the side if we were attacked. I mean, it was all, and once a week we would practice with our star rifles and a pillow slip over our heads, stripping it down and putting it back together again. And they were very keen on us being proficient with the weapons. Unfortunately, we didn't have to use them, but it was a different experience. And I was reflecting at the time that my colleagues were probably in the Hilton International in Hawaii or somewhere, and here I was in the boiler room. Yeah. We'd have breakfast, and look, I can't stand long life milk and whatever, so I started eating my cereal with orange juice, and I really didn't stop then. So I'd have whatever was cornflakes or something like that, and then we'd do ward rounds, and we'd probably have theatre scheduled from maybe 9 o'clock in the morning. We'd have a lunch break and then theatre in the afternoon again. But it was often interrupted by what came in through casualty. And the pace of the work varied. So some days you might get 3 or 4 really gross injuries coming through. And then you might spend a few days staging what you had to do for them. So you might have started off by cleaning up all the wounds and doing initial surgery, and then you might have to come back a day or two later and close some of those wounds or do some more revision and that sort of thing. And because blast wounds are so devastating, you have to use a bit of ingenuity as to what tissues you can keep and what you have to cut off and all that sort of stuff. And so it was variable, and the pace was variable. And the trauma, look, it was very important to support the nursing staff and the theatre staff, because most of them had never seen anything like it. I mean, we hadn't seen anything like it either, but we had been involved in surgery for a long time. And so, we were more familiar with some of the grosser aspects of it. But for the staff, it was new, and I know 1 or 2 of the nurses had difficulty. And one of the senior officers thought they could handle that by ordering them, and that they should take orders. And I can understand that approach, but it doesn't work. You really got to cope with their psychological issues, and it's not easy for some people to understand that. Most people were very professional. I actually have to say how professional, not only the medical side of it, but the trained military were very professional. We felt safe, and we felt we were in competent hands all the way. Yeah. We had an interpreter who was a local Rwandan who spoke French and the local dialects, and because even more so when you don't speak the language, you need to communicate with the family and with the patient, and that, to me, that was an essential part of what we did, having good interpreters. And we had some time that we spent down at the local hospital, which was part of the whole complex. And there were some American NGOs there as well. And we used to do a clinic down there. And it was largely burns and that sort of thing. Burns are very common in third world countries. Babies roll into fires in the middle of the night and all that sort of stuff. And the nurse who ran that was a lovely lady. She was like a Rwandan. And she had paid the Tutsis. No, she'd paid, let me just think. Well, she paid whatever the group were that came, knocked on a door, to shoot her parents rather than hack them to death. And I think actually she was a Tutsi, so it would have been a Hutu. But, and then she managed with her kids to escape. But she told us the story of how it was, she had to pay rather than have her parents hacked to death. And that was the other type of injury, of course. The machete injuries were often, if they survived, were often quite a lot of challenging work. Yeah. But what we did, we'd get up in the morning and we'd actually go for a jog in the cool of the morning and the mist. And we only went a couple of k's down the road and back, down to the Hotel Rwanda and back. And and it was not only were we jogging, we were talking, because we were discussing what we'd done or what was on the agenda that day. And but that was one way. And the other thing we did was on Sundays to escape the hospital, we'd go to church. And this was an amazing thing that they had. They're very tough people, and you go to church and there was virtually no sign of emotion until the prayers for the dead, and then it was very limited, which amazed me because I thought there'd be much more emotional outpouring, but it wasn't there. And the other amazing thing is you'd see women going to the markets or downtown who were living in mud huts, and they'd come out dressed immaculately in white clothing. I mean, how they did it was beyond us, and they just kept up their spirit. Yeah, so one of the things we did, the Gurkhas arrived, and they were in force really to look after us, and we were invited around to dinner with the commanding officer for one night in his mess, which was a very interesting experience. He was telling us that they brought all their unit silver, the regimental silver, and they were there for I think 2 years. And he said most of the troops that came with him, that would be their income for retirement forever. The money went back home, and they were a way of making money. Then he said to us, do you know how many folds there are in an Australian Army puggaree on your slouch hat, and the history of it? And we were, first of all, we're medical, so totally ignorant. But he said, well, there's one fold for every state of Australia, which is something I didn't know. And I noticed that the New Zealanders only have 3.5 folds, whereas I think we've got 7 or whatever it is. So we got a little lesson on our own uniform from the commander of the Gurkhas. I think we slipped through the net there because we were more or less individuals going back to our individual situations. We weren't part of a group or and maybe they thought being doctors we could self-cure or something, I don't know. But the one thing I do remember, we went into town, Mary and I went into town, we went into DJ's for some reason or other, I think I wanted to go down to their food hall and enjoy a bit of nice food. But I remember feeling like I was floating, detached from the reality of the city. And it was an unusual feeling. It didn't last long when I was back in reality. But no, it was just, that's the one thing I do remember is feeling I was different and detached. I think my family, that was very important for them to support. We had planted, believe it or not, several hundred olive trees on our farm just before I got called up. And it was a drought in the Hunter. And on the weekends, they'd load up a trailer with water from our home in Sydney, and they'd take it up and they'd water all these trees. We had plastic bags that we had around, and they'd drip the water out over the week. We didn't lose an olive tree in the 2 or 3 months that I was out of action from preparation and getting there and all that sort of stuff. So I was very proud of them for doing that, and they thought it was their duty to keep the olive trees going while I was over in Rwanda. It was something I was very pleased that I did. It meant that my time in the reserve was worthwhile, and I think it gave me purpose. And afterwards, I actually did give quite a number of talks about it, and we actually recruited people young doctors and that, who'd come along and see the talks, listen to the talks, would join the Army Reserve, or sometimes we lost them to the Navy or Air Force, but they joined the military as a result, So I thought that was positive. I now chair the National Centre for Veterans Healthcare, which is an initiative of Central Sydney, or Sydney Area Health, and we have set up a one-stop shop for veterans with post-traumatic stress disorder and other issues, including we're just about to open some residence for their families to come and stay in. So it's actually given me a pathway to do things, and a rationale for being on these committees and on this board, because I've got the link. My professorial career kept going, but I had this additional, and I worked at Concord, which had this long tradition with the military. So I've been involved in lots of para events, and with the tag that I always served in Rwanda sort of helps, I think.